Welcome to the summit. I'm Dr. Julia, and I'm going to be speaking to you today about problem origins. I connected initially with Rhonda and Dr. Galan at Airway Coach because we are all passionate advocates in this space. While they're focused mainly on supporting adults with all things airway and breathing health, I at Oris Wellness am focused on supporting parents in navigating these issues in their children who are still growing. So if you find that you or your family need any help, please don't hesitate to reach out to any of us. We all would be happy to support you. So let's get started. When it comes to knowing where we're going with various treatment options, sometimes it's really helpful to know why the problem exists or kind of where we've been to know where we're going. So when I talk about this, it's really not to cast any blame on any parents, any individual decisions, any medical teams. It's really more a reflection of how society has really changed in modern times. And part of that change as we evolve intellectually and technologically, we have to look at how some of our new habits in our new world are creating new situations that we may need to compensate for in other ways in order to keep our health on track. So we're going to just talk about some of these topics where the problems originate. The first step at looking at baby's airway health is to look at mom's airway health. Sleep disordered breathing in a mom is actually associated with some of the following. It can be associated with preterm delivery, low birth weight, NICU admission, and intrauterine growth restriction. So these are some of the things that we don't necessarily think about. Obviously, there's a whole lot of other implications with nutrition, but we want to first ask how is mom breathing? How's mom's airway health? While the baby is developing during the third trimester, there's a lot of important anatomy that's still developing. So when we have a situation where there's a premature birth, some of that anatomy isn't fully developed. That could lead to different issues with breathing properly or feeding properly. There's even these little kind of fat bundles that develop in the mouth that are serving a purpose to actually help facilitate better latch and better feeding. And that's something that if a baby's born early, premature, before that develops, then that feature never develops on its own. So that's one reason why we might see some more common feeding issues simply from being a preemie baby. Also, suck swallow training is happening in utero, and that's something that is preparation for feeding on the other side. So if a baby's born early, they're not getting all that practice in. So with positioning in utero or even the actual birthing process, birthing method, or birthing trauma, there are different forces that can be applied to the head or neck that are going to influence a lot of things. So I'm first going to explain a little bit about cranial nerves. So we all have these set of sort of VIP nerves that instead of going up and down the spinal cord, they actually have these little like VIP doors that get them through the skull to exactly where they need to go. Most of this is because most of these are dealing with some of the senses that we have, sight, smell, some of these senses that are housed in the skull. So it's worth mentioning that several of these cranial nerves actually pertain to movement of the face and the tongue and the throat. 5 of the 12 actually influence the tongue, which is pretty incredible to think about. And I think a pretty good indication of how important the tongue is. If you've heard of someone getting cranial sacral therapy, some of that can be to relieve the way that the bones are to allow for kind of better nerve messaging with some of these cranial nerves. And that ties in really to the rest of the musculoskeletal system. So not just what's happening with that set of nerves, but really looking at the body as a whole. So with situations like head molding, sometimes with soft tissues of the nose in utero, if a baby's positioned in a certain way, then the nose might get a little squished. If a baby also has tension in the body, that can lead to different conditions like torticollis, which may affect how the baby moves and how the baby feeds. And it's going to prevent a child from getting into a more relaxed state for better sleep and better digestion. So it is worth mentioning also that some of the tension in the body, it's not always going to be real obvious, like flexing of the fists or clenching of the fists. It might be more subtle because our body is so smart that it actually finds ways to do what we call compensate, in which it sort of finds ways to make things work, even though they aren't working optimally. So, a nice analogy that often gets made is running with your shoelaces tied together. You can still do it, but it's not going to be as efficient as what you could do if your shoes were tied in the appropriate way instead. It's going to be more exhausting. You're going to exert extra energy and you're going to have to find kind of ways around the limitation. With the autonomic nervous system, our body, I had just mentioned that kind of rest and digest that gets disrupted by some of the tension. Our body has the switchboard that goes between that fight or flight mode and that rest or digest mode. We really need both working. And if there is tension in the body, that's one thing that can kind of flip the switches. Also, how we posture ourselves, how we breathe, how our muscles are working. These are all things that can flip some of those switches. When we're born with certain automatic behaviors. These are called reflexes, and those are meant to help us know first how to get out of the birth canal and be able to survive on the other side. So they're ready to go, and there's definitely a sequence of events. We sort of stack, kind of move through different phases of these reflexes where they get replaced with other skills down the road. And so when we look at if something didn't go right in that sequence of events, or if there was some stress, sometimes the birthing method, so being born by C-section, is enough to be one reason why we might see a change to some of these sequences of reflexes that are supposed to take place. There are a variety of conditions that may be present at birth that are going to influence how the face grows, as well as adding layers of difficulty with kind of how breathing patterns are as well. So these are some of those conditions that might be genetic, they might be developmental, but they are going to have an effect on how the child's breathing. Breastfeeding to bottle feeding. So when we look at early habits, the successful function of the tongue is very important here. So the range of motion specifically is one of the reasons why so much attention has been paid to tongue ties, the topic of tongue ties and feeding efficacy. If the tongue is physically limited from its ability to move in a certain way, then the way that we swallow won't be the same, and more air can be introduced. Those compensations that I just mentioned are going to come into play. So everything's going to be more exhausting and more difficult and less efficient than it was meant to be. With strength, there are actually 8 muscles in the tongue. If you've ever tried any myofunctional therapy exercises, you probably get the feeling real quick that our tongue can actually get sore, just like any other muscle after a workout. And it's something that we think about working out all these other muscles in our body, but we don't always stop to think about the tongue and those muscles to make sure they're doing what they need to be doing. And coordination, again, a lot of this should be automatic as it's part of kind of the reflex system that I was talking about. But from birth trauma or tension or restrictions, it doesn't always come naturally. So certain conditions like reflux can take place if proper coordination isn't taking place during that sucking and swallowing. And that's one of the reasons why a family might rely on bottle feeding over breastfeeding if they're having difficulty, because it's just going to require less skill comparatively to partake in the bottle feeding. And when we talk about the benefits of breastfeeding, Of course, there are nutritional and immunological benefits, and that does still factor into breathing health because fewer allergies are going to mean better breathing. Maternal transfer of antibodies are going to mean less frequent or less severe illness. So it's really incredible all of these sort of indirect ways that this can influence better breathing. But for our purposes today, I just want to highlight how it more directly influences the growth trajectory. The muscles are creating a vacuum in the mouth to extract the milk out of the nipple. And there's a lot of forces that are being applied to the roof of the mouth that actually influence how the jaw will grow and develop. And so this set of forces is not going to be the same when a bottle is used versus breastfeeding. And we also just consider that a baby is born as a nasal breather, and part of the amount of time that they spend with their mouth full is actually still training for nasal breathing, if you think about it. As a dentist, I have to mention malocclusion. This is the term that's used when the teeth or the jaws aren't lining up in the exact relationship that is considered ideal. And in the study on a large number of 5-year-old children, there was actually 72% lower chance of these children who made it to 6 months of age exclusively breastfed having moderate to severe malocclusion. So we wonder why everyone needs braces these days, but I think this is pretty telling. Our society doesn't set parents up to be able to make it to 6 months of age exclusively breastfed. It's not an easy or effortless thing to do. Of course, everyone's interested in talking about the gut microbiome these days. I did just gloss over the effect that breastfeeding would have on establishing a better immune system. Our immune system is dependent on what's going on in the gut, but our gut is part of the whole body, right? And that when we think about that whole tube, it all starts in the mouth. The mouth is the beginning of the tube. It's the gatekeeper where this all begins. So when we think about it that way, we really have to start with the proper mechanical chewing and swallowing of food in order to kick off easier digestion and absorption. As we look into all the downstream effects of poor breathing, it becomes apparent that with poor breathing, we're going to actually see more medical conditions that are going to require medication, antibiotics, pain relief, reflux medication. All of that's going to be hitting that gut microbiome in an early critical foundation. So the health and happiness of our gut is going to influence the nutrient absorption, vitamin levels, and so much more. Some of the most common nutrient deficiencies that are seen in children are iron, vitamin D, zinc, magnesium, and omega-3s. So something to keep on your radar. And our modern day diet has changed significantly from what our ancestors ate. So Weston Price was a dentist who traveled the world in the 1930s, comparing the diets of some more indigenous, non-Western communities. So I'm not saying that I personally keep up with his dietary recommendations, but I think it paints a really good picture of what's changed in modern times. You may hear about how our skulls are changing thanks to some of the work from Dr. Kevin Boyd and Dr. Mariana Evans that's discussed in James Nestor's book. This is not evolution in the classic sense of good traits being passed on. It's a sort of devolution. Changes are taking place in order to help us survive and adapt to the modern hostile environment. And when we think of health foods of today, so many of these foods are soft textures. We've got smoothies and nut butter and oatmeal and avocados. It's really been made effortless in contrast to what our ancestors had to do to shred and chew the food in order to be able to eat it. So the textures we're exposed to and the nutrients we get, it's not the same. Baby-led weaning is a method that you'll hear about for the initial introduction of solid food for babies starting at a young age, around 6 months. We kind of need more of this concept to extend just beyond that initial introduction. It's really something that should be going on later into childhood, is making sure we're getting crunchy foods and practicing good chewing. It's worth mentioning here that some children might be pickier eaters because that's all they've ever known, and it's just kind of the world that they live in. But some children who actually do have more airway issues might be picky eaters because that is going to be kind of an adjustment that they can control in terms of managing the time frame that their airway, that if they're using their mouth to breathe, that their airway is otherwise occupied. So that's just something to keep in mind. I have to dedicate one moment to Pottinger's cats. This was a scientist who fed raw meat and unpasteurized milk to one group of cats, and then the other group got fed cooked meats and pasteurized milk. So I'm going to read from you a quick excerpt from Dr. Stephen Lynn's book, The Dental Diet, as to what the findings were. The first generation developed crooked teeth and inflamed gums. The next generation weighed on average 20% less at birth and had severe skeletal problems. Their skulls, including their cheekbones and sinuses, were deformed, thin, and weak. It turned out that they had less calcium in their bones than normal cats did. Continued generations had allergies, skin conditions, leading up to reproductive issues. It definitely makes you think. It's not just the food we eat, but our habits that have changed a lot too. So I'm going to talk about pacifiers for a moment, but please do note that the American Academy of Pediatrics does recommend pacifiers because it's been linked with a reduction in SIDS. But when it comes to these tools, design matters. So there are certain shapes that are going to allow for the tongue to have certain functions or get its tongue resting position up higher than other designs. When it comes to the benefits of thinking about using a pacifier, pacifiers do help us with digestion. They're going to increase saliva flow and increase the release of feel-good hormones. It can be used to soothe, to provide pain relief, and even can be used to actually help reposition the jaws in order to facilitate better breathing. So there are a lot of early advantages, but all of these things can be kind of addictive if you think about feel-good hormones and breathing hacks. So then we just have to worry about what happens when these habits overstay their welcome. After 6 months of age, these habits do come with increased risks for ear infections and dental malocclusions. I'm not saying it's easy to break these habits, but when we start to see prolonged use, so if your child is not able to kind of give up these habits and they're around age 3 or 4, then we definitely want to be seeking some help at the very least before the permanent teeth enter the equation. The sooner the better if you recognize that you're having a hard time kind of ditching the habit or modifying the habit, get some help. There's plenty of professionals who are available to offer guidance. And then I did have sippy cups on the slide because I just do always feel like it's worth mentioning that that is a tool that's really invented for the parent's convenience more so than the benefit of the child. If we can work on instead going to straw drinking or open cup drinking, it's definitely more advantageous. So oral habits and oral myofunctional disorders. This could be alterations in breathing, sucking, chewing, swallowing, and speech, as well as the position of the lips, including what's known as oral rest posture and the cheeks. So this could all be caused by any of the factors that we already discussed, but this is where so much of our time needs to be spent when we're looking at what we can do to promote better breathing for a lifetime. It's worth taking a look and recognizing this is where I was talking about some of our technology and habits and evolution that has taken place has led to different postures if we're looking at text neck or otherwise. So we have to be concerned with all of that here. We know that we're going to have better breathing if we have better body posture, if we can get the body positioned in a way that supports better nerve conduction, and we're getting in better body movement. All of this, we see more babies these days with situations like they call it container babies, where they're in their car seat or they're in their swaddle, they're not getting the right movement. And so all of this is going to affect how we breathe. And of course, plenty of time, if you've been following this topic at all, is spent on looking at the differences between nasal breathing and mouth breathing. So for me, when I went through dental school, one of the strangest experiences is you start that whole experience with a head and neck cadaver. And while I didn't love that experience, it was really eye-opening to actually see how much space the nasal cavity takes up. So the nose is actually warming the air, moistening the air, filtering the air. So there's a lot that we don't want to end up in our throat or in other parts of our body. It's protecting us. And it's also producing a certain kind of natural chemical in our body called nitric oxide, which has other benefits on our body and our cardiovascular system. And then I did mention before, again, those switches that switch between that rest and digest state and the fight or flight state. And one of those switches is whether we're breathing efficiently through our nose or if we're breathing not so efficiently through the mouth. So on the flip side, when we're breathing through the mouth, it can irritate the tonsils and adenoids. If we're mouth breathing, then the tongue's going to be in a low posture, closing off part of the airway and influencing how the face grows. It's also going to increase the risk for dehydration and increase risk for cavities and triggering that more fight or flight, less efficient breathing. So again, James Esser's book that I mentioned before, they reproduced, him and a colleague reproduced the study where they plugged the nose, which was done to copy what was originally Harvard's monkeys study. And when they plugged the nose, they saw that, mouth breathing habit kind of changed the way that the monkey's face looked. And I feel like it's just a really common representation of what we see today. We see children who are looking like this, and it's not just children. We then see that turn into a pattern where we see adults who are living on sinus medication and they're always walking around kind of stuffy and really struggling, but it's something that they may not know where to go to improve things. So when we talk about supporting that better nasal breathing, part of that is looking at, can we breathe through the nose? So sometimes there are actual obstructions inside the nose that's preventing proper nasal. We use an analogy that the air flowing through the nose is kind of like a two-lane road. If there's an area that's closed off for construction, the flow through that area isn't going to be so ideal. And that's kind of the same thing that can be happening in the nose. So there are certain bony structures or soft tissue structures that might be inflamed or might have grown differently if we have a high palate or a deviated septum. That's all something that can influence how the air is flowing through our nose. And some of it's also just going to be more temporary conditions like mucus production or that inflammation that I was mentioning. A few tests that you can do at home to check nasal obstruction is doing a 3-minute test. You can either put some water in your mouth or you can tape the lips or you can try different things in order to kind of gauge if there's a mouth breathing habit. Is it just a habit or is it truly out of necessity? If 3 minutes feels like a struggle, then maybe we do have some obstruction in the nose and we need an ENT to take a look and see what's going on. There are a few other tests you can do also. There's kind of a sniff test. You can inhale really rapidly and kind of have the head tilted up to see whether the nostril stays open or if it kind of collapses on itself. And also something called the Cottle maneuver that you can do to try and see if you put the right amount of pressure on kind of the side of the cheeks and open. Do you feel a difference then? So there are a few different tests you can do at home just to check on how nasal reads. With tethered oral tissues, I'm optimistic that there will be someone who's going more in depth on this topic, so I won't spend too much time here, but it's worth mentioning that this is one of those problem origins. We all have kind of a sequence of development that takes place, and so that's why we all have sort of that stringy part, that frenum, to some extent or another. But what happens is that is meant to guide our development and the development of the tongue. But if it doesn't kind of dissolve away like it should, then we're left with something that can restrain part of that tongue and restrain the movement of that tongue. And that's really what comes into play here when we're looking at kind of diagnosing tongue ties. The old school thought was just that, like, if that little stringy bit was attached to the tip of the tongue, then that was the only true tongue tie, or what we call an anterior tie. However, we now know that if the tongue mobility is restricted to various degrees, then that is also a tie. So that's why we're not using photos to diagnose someone. We really want to be looking at visual exam, but we also want to be looking at how is the tongue functioning and what are the symptoms we're dealing with. If we're seeing things like reflux, clicking during feeding, speech issues, picky eating, there's a variety of presentations of symptoms that can clue us in to the fact that this may be part of the problem. And unfortunately, the verdict's still out on what is like the further root cause of why we develop tethered tissues. We don't have a clear answer for that yet. So hopefully by now you've kind of gotten the idea. These things are complicated, and my goal is to always help parents to understand how muscle function ties together with the way that our face grows, the way that we breathe, the way that we sleep, how all of this ties together for better health. But when I was talking about where we're going and how we treat things now, it's really helpful to go back and look at the beginning, because you'll see here, I've kind of just outlined some brief scenarios that you can end up with a symptom like mouth breathing. And maybe on the one hand, that started with a child who got a cold and they were congested and they started snoring and now they're mouth breathing. But on the other hand, maybe it all started when there was a tongue tie, and maybe that tongue tie held the tongue in a low posture and that affected the way that the upper jaw grew. And now you have someone who's habitually. You can see how these two scenarios might lead to a different kind of plan of attack or a treatment plan for how we want to address these. And similarly, we'll just do one more example, poor sleep. I didn't spend as much time on that, but our sleep is a critical piece of the puzzle here. When we're sleeping well, the rest of our body is going to be growing. And if we're not breathing properly, then that's going to influence the quality of sleep. So on the one hand, we might have some nerve messaging that's off from the very beginning, and that's going to affect how a child swallows. We might see at that point that the child gets recurrent ear infections because the draining from the ear to the throat isn't taking place properly. And then if they're getting put on various medications, then that's going to hit the gut microbiome, like we talked about. And maybe that's the driver for sleep. On the other hand, maybe we just have a baby who's born premature and they're going straight to bottle feeding and they've got a picky or a soft diet. And now, again, we're left with a narrow upper jaw. So growth has been affected. And now their breathing's not great and sleep's not good. So again, how we go about treating this and where we start with treating this might vary depending on where we began. So we don't always find the answer to that, but if we can go back and we can try to put these pieces together, it can be a really helpful piece of the puzzle. And if that sounds like something that you're interested in, you can always schedule a free discovery call with me. It's a chance for introductions, for me to learn about you and to see if I can point you in the direction for next best steps. So feel free to scan the QR code there, and that'll take you to be able to set up a free discovery call. That was a pretty good overview of kind of where some of these problem origins begin. Hopefully you found it to be really insightful and you learned something. I'm so glad to be a part of the summit, and I hope you're learning lots. Thank you again for taking the time to be with me.